Coming toward the uses of the loop diuretics, so due to their excretory property, they will excrete the excess amount of fluid and will relieve the renal and cardiac edema. As you can see here, that these drug causes excretion of the calcium, so they are used in the hypercalcemia. Due to some mechanism, they produce the prostaglandins, and we know that prostaglandins will increase the diameter of the veins, so will cause increase in the venous capacitance. So there will be shift of the fluid from the pulmonary circulation to the systemic circulation, and there will be decrease in the left ventricular filling, which will relieve the symptoms of the acute pulmonary edema. We have discussed earlier that furosemide IV is used in the hypertensive emergencies. They are also used to decrease the volume overload and the blood transfusions. Coming towards the adverse effects of the loop diuretics, so there are mainly two types of adverse effect. The first one is the ionic and the second one is metabolic. So among ionic there will be hypokalemia, hyponatremia, hypocalcemia and hypomagnesia. Hypokalemia occurs due to the increased amount of sodium in the distal convoluted tubule, which will lead to the increased activity of sodium and potassium pump. This sodium potassium pump basically absorbs the Na and excrete the potassium. So increasing its activity will increase the loss of potassium, leading to the hypokalemia, which is very important causative agent of arrhythmia. The next one is hyponatremia because they excrete the sodium. The next one is hypocalcemia because of excretion of the calcium, and similarly hypomagnesia. Coming to the metabolic the metabolic adverse effects, we have hyperglycemia due to decrease in insulin release. We have hyperuricemia. This point should be discussed here. Let's suppose this is the proximal convoluted tubule, and there is secretion of acids, weak acids into the proximal convoluted tubule, and weak acids basically compete for these transporters. So we know that the loop diuretics are acidic, and the uric acid is also an acid. So these two will compete for this transport, and whenever loop diuretic are in excess amount, they will be secreted to the proximal convoluted tubule, and uric acid will be retained in the blood, causing hyperuricemia. Hyperlipidemia is also an adverse effect. Moreover, ototoxicity occurs due to these drugs, which have symptoms of tinnitus plus vertigo, plus there will be deafness. Moreover, they are sulfonamides derivatives, so hypersensitivity reactions may occur.